analysis of a drug-coated polymer stent with XPS and Argon cluster depth profiling. Cardiovascular interventional therapy with stents has emerged as the most effective method for coronary heart disease treatment. However, blood clotting and overgrowth of these stents has caused significant problems in use of these devices once they're implanted into the body. In this presentation, we'll be investigating the surface of drug-loaded polymer stents. The pursuit of discovering a material with ideal surface properties and essential mechanical properties is a continued work in progress. The current generation of stent materials tends to trigger various adverse reactions, as we've mentioned. Most of these issues arise due to the interface problems between the stent surface and its immediate environment. Polymeric materials already possess the proper bulk properties, for instance, light weight to volume ratio, exceptional corrosion resistance, easy processing and molding, and excellent mechanical properties. So the main focus of most research groups lies on modifying the surface of materials without altering the bulk properties. Of specific interest in the development of the bioresorbable stents is the distribution of anti-inflammatory drug material through the surface coating of the stent. For this study, we'll be looking at a drug containing nitrogen, which we will use as the marker for the drug material. Here we highlight the capabilities of XPS, the technique that we will be using primarily to investigate the structure and distribution of the drug in the coating material. We can determine the quantitative chemical information by curve fitting our high resolution spectra. In this case, we're showing the carbon 1s spectrum from our polylactic acid pure stent polymer. XPS is a non-destructive technique, so samples can be characterized prior to use without affecting their material properties. It's surface sensitive, so we're only probing the uppermost 10 nanometers of the material. Part of this study will also involve the depth profiling through the material, and we'll discuss that in later slides. So let's have a look at the survey spectrum of my material. The physical dimensions of the stent meant that the selected area spectroscopy was used, acquiring data from 110 microns, so that we're not getting any signal from the surrounding sample holder or platform. The stent polymer and drug chemical structure consists mainly of carbon and oxygen. Here, the differentiating marker atom used to evaluate the drug concentration is nitrogen, and we can see this as a very small signal in my spectrum. The nitrogen concentration in the pure drug is 1.5 atomic percent. Analysis was performed from 3 independent positions on the abluminal or outer and luminal or inner surfaces of the stent material. It was determined that there was greater nitrogen concentration on the abluminal surface relative to the luminal surface, thought to be consistent with the manufacturing process. Our next motivation was to investigate the drug distribution towards the bulk of the thin film coating. This was achieved using depth profiling. Our spectrometer is equipped with the latest generation gas cluster ion source. Recent advances in ion sources have focused on the use of large Argon clusters. Monatomic ions, the more common projectile for depth profiling, tend to create a collision cascade with the momentum focused towards the bulk of the material. Delicate polymer samples, the energy of the monatomic ion can cause significant damage to the chemical structure of the polymer and drug matrix. Using our larger cluster ions, models show that there is very little penetration into the bulk of the material, and this is a much more gentle sputtering process. The use of cluster ion sources has opened up the possibility of successfully depth profiling polymer materials. So here we show the elemental concentration as a function of sputter time through the material. In this case, we're characterizing an abluminal coated surface. Depth profiling was achieved using 10 kV Argon 1000 clusters, which allows for rapid etching and reduces experiment time. You can see that the changes of stoichiometry are consistent with profiling through my drug-containing layer and into the bulk of the PLA polymer stent. Nitrogen concentration, marker for the drug material, shows reasonably constant concentration through the drug-coated layer and a sharp interface as we move into the bulk material. It is estimated that this drug layer is approximately 1.8 microns thick. Investigation of the chemistry as we sputter through the material, it allows us to build up a model of the drug position through our depth profile. We peak fit the carbon 1s envelope. If we start at this end, we can create a model for the pure polylactic acid. We can propagate this model through our depth profile and generate another model shown here in red, which corresponds to the drug material. The as introduced surface, we have a mixture of drug and polylactic acid. We can see that this is constant as we move through the film through to the bulk polymer material. So we've characterized the as produced product and demonstrated uniform distribution of the drug through the thin film. We've also extended this study to aged stents. Stents were submerged in a phosphate buffer saline solution for 1 to 3 months, noted by 1M, 2M, 3M. By employing XPS analysis of the coating and stent material, after removal from the solution, we can gain valuable insight into the surface properties of the materials themselves during this dissolution process. It's important to understand the drug distribution in the remaining stent materials, because this will affect its efficacy during use. Peak-shaped models determined for the as-received abluminal surface were used to fit this carbon 1s envelope. In applying this to the stent samples that have been in PBS solution, it was necessary to include a significant hydrocarbon contamination, here shown by the yellow component. So we can see that the stent materials that have been in solution have a large hydrocarbon contamination. Here we have an overlay of nitrogen concentration depth profiles. For the immersed stents, the interface between the drug layer and the stent bulk is not as sharp, indicated by significant paling in the profile. It is most likely due to pitting and corrosion of the stent structure, a well-documented effect of the solution exposure. It's interesting to note that the stents which have been in solution have a much lower nitrogen concentration. This decreases even further on the first etch cycle. Then as we profile into the thin film, we can see that the concentration of nitrogen returns almost to the as manufactured concentration. So this allows us to generate a model that is depleted of the drug at the very outer surface. We quickly resume the drug concentration through our thin film until we turn to the polylactic acid of the material. So in conclusion, we have shown that XPS is suited to characterization of these drug-coated polymer stents. The nitrogen that is present in the drug polymer blend and not the polymer stent support material acts as the marker for the drug. This allows a quantitative study concluding that there is more drug material on the outer abluminal than inner luminal surfaces. The abluminal surface of the as-manufactured stent was fully characterized for drug concentration, layer thickness, and drug distribution. Aging experiments were performed to see the dissolution of the drug from the stent into the PBS. XPS is an enabling technology allowing the analysis of novel biomaterials. The spectroscopic performance of the instrument allows low concentration elements to be detected with high precision. The use of our cluster profiling allows delicate polymer materials to be analyzed with confidence.